going to use a different format for presenting the usual daily health emergency operating center report. So this afternoon I'm presenting the report for the Federation of St. Kitts and Nevis. The Ministry of Health, we usually use data from the World Health Organization. This data is verified. And today, the total number of confirmed cases globally stands at 3,759,967. The total deaths are almost 260,000. Now let us look at testing. To date, 327 persons within the Federation have been sampled and tested. We have had 15 confirmed cases and 311 of the samples returned negative. Again, I want to underscore that we continue to test individuals who are suspected cases, persons who would have signs and symptoms of COVID-19, persons who would have met the definition provided to us by the World Health Organization. We also tested contacts, and we have also tested individuals who would have come into country from hotspots. We've had, as I said before, 15 confirmed cases. We would have announced our first 2 confirmed cases way back March 25th. And on March 29th, we announced a further 5 positive cases. And on April 19th, that is 19 days ago, we announced our last or 15th case. So in total, St. Kitts has had 11 confirmed cases, Nevis 4 confirmed cases. Let me just share some demographic information with respect to the confirmed cases. Now, in terms of gender, 53% of the cases are male, 47% female, and this is in keeping with the global or international trend. In terms of clinical manifestations, 87% of the cases presented with symptoms, and 13% were symptom-free throughout the course of the disease. The most common symptoms noted amongst our patients were fever, cough, sore throat, weakness or malaise, and some complaint of runny nose and headache. Now, in terms of some other information, demographic information, the cases, the age ranged from 9 months, as young as 9 months, to 66 years, and the mean age was 32 years, and 60% of the cases fell within the age band 20 to 40 years. The incidence rate with respect to cases in the Federation, 3 per 10,000 of the population. Now, let's just talk about a little bit about transmissibility of the new coronavirus within the Federation. Now, there is a statistic deemed or termed the reproductive number. This describes the level of contagiousness or transmissibility of the virus. It gives you an idea with respect to the number of new cases that an existing case generates. And so because of the public health measures that we employed here in the Federation, we have been successful in reducing the reproductive number to less than 1. Based on our data, it's about 0.3 to 0.6. And it's because of this achievement we have been able to contain this first wave of infections. The next slide shows that of the 15 cases, of the 15 confirmed cases, only 3 cases transmitted or passed on the virus to 1 or 2 close contacts. The other 12 cases did not transmit or pass on the virus to anyone. Again, this is an achievement because of the stringent public health interventions that we employed. Of the total 212 contacts traced, only 5 cases were positive. Now, as at today, May 8th, we have a total of 56 persons in quarantine in a government facility. We have 4 persons quarantined at home. 2 persons remain in isolation. And I want to bring you the good news that we now have 13 cases who have recovered. Number of persons released, the total number of persons released from quarantine stands at 752. Let me repeat, we now have 13 cases who have recovered. All right, so this slide highlights that. And so in St. Kitts, we have 9 cases who recovered, and then all 4 cases in Nevis have recovered. The average duration, well, based on our data at the Health Information Unit, the average duration between diagnosis and recovery is approximately 30 days. And so, ladies and gentlemen, we have been able to achieve this through our local or national operational response. And let me just summarize briefly. And so the Ministry of Health, we developed and updated our National Pandemic Virus and Infection Preparedness and Response Plan. And this plan provided us the roadmap, which we followed over the past 3 to 4 months in terms of managing this outbreak. Very early on, in January, February, we sensitized and trained the staff, not only in the Ministry of Health, but across sectors. Surveillance. We stepped up and strengthened our surveillance, particularly at our ports of entry, very early, again, from as early as January. And this continued, and we were able to pick up our cases, identify our cases very quickly, and we were able to aggressively trace all their contacts. In terms of infrastructure, there's so many things that we did. For example, at the JNF General Hospital, changes in the emergency room, in the various health centers. We have tents erected at the Mary Childs Hospital, at the Poxon Hospital, and so we strengthened much of our health system in preparation and in response to this outbreak. And some of the main public health interventions employed include a massive public education campaign, and that we are very proud of. We really, encouraged everyone to be active in terms of hand and respiratory hygiene, physical and social distancing. We were able to achieve this with the aid of the announcement of the state of emergency and the curfews. Next slide. And then the legal framework, as I mentioned, the state of emergency and the various regulations that provides the framework for us to enforce physical and social distancing. And for that, we are thankful. And then in terms of emergency supply chain, very early in the game, we sought to procure the required equipment and medical supplies that would be necessary to fight this outbreak. And then I think we can say with pride that it has been an all of government, all of society response, and we couldn't have done it without collaboration or collaborating with our local, regional, and international partners. We want to say thank you to the local entities, public and private, who have been so generous in their donations. The Caribbean Public Health Agency, in terms of the lab, that provides us support in testing our suspected cases and our contacts. and the capacity building that the Caribbean Public Health Agency provides. The Pan American Health Organization's office in Barbados, very, very helpful in terms of capacity building and technical support as we fight this pandemic. The World Health Organization in providing us the well-needed resources, case definitions, etc. And the International Atomic Energy Agency, who is now providing us with a molecular machine, thermocycler molecular RT-PCR machine. And so very soon, St. Kitts and Nevis will be able to offer the molecular RT-PCR test in the public sector. And so that for that we are thankful. And I want to end by providing the websites on which you can log on to these sites and access the national statistics for COVID-19. Thank you.